Good morning. Now, hopefully everybody can see my screen. I can get a thumbs up and we'll go ahead and begin. As my role in promoting community health and public health and training promotores de salud in San Antonio, there are some real basic understandings about how our vulnerable populations would best respond to the outreach efforts of community health workers. And even in the age of COVID and monkeypox and other things, we have to understand that our families and our community residents live in an environment in which there are other stresses that affect them and have a pronounced effect on their overall wellness. So this morning, what we're going to take a look at, let me get over there, is we're going to look at stress and particularly high chronic levels of stress, which are often defined as distress, that certain segments of our populations, certain zip codes within our community here in Bexar County and throughout South Texas, their environments are extremely high stress, and that stress lasts for long periods of time. We're going to look at the role and what community health workers bring to the table as a specific set of skills that will help individuals and families cope with this uncertainty and cope with the chronic stress. We'll do a case study in which I'll introduce it to Ludvina's case study, just kind of give an introduction to it, and then we'll take a look at how that particular intervention goes at some of the underlying causes of stress and how that can help build stronger relationships and influence behavior. And then we'll be followed by a question and answer session. And please don't be bashful. If you've got some questions or whatever, you can enter them in the chat box. I'll review the chat box at the end. And if any of them need a response later on, I will get that to you. Now, are any of us familiar with stress? I mean, it just seems that all you have to do is pay a little attention to the news or the social media feeds. And we've got the variants of COVID. There'll possibly be other variants for maybe in the near future. We'll be seeing those over and over again. We have a virus, smallpox, that's now prevalent in some parts of our country, and we're seeing it in Bexar County. And people have a lot of questions about what is it, how can I get it, how can I get treated? There's shortages dealing with inflation. Not only are the cost of things going up, like groceries and gasoline and rent, but also some products like formula became scarce, adding a tremendous amount of stress to families with newborns or formulas, or excuse me, infants needing formula. Gun violence is just epidemic. Whatever position you have on gun violence is that we have more guns and more people are being killed than at any time in our history. All right. So that's another stress that adds to people, and particularly on the first days of school this week, it was on the minds of a lot of children, and that kind of stress should not be there. And then we just have our regular old day-to-day stress. Your hypertension, your diabetes 2, you know, am I at risk for cancer because I haven't had a colonoscopy in 20 years? All of those things that have a behavioral component as far as increasing your risk to a chronic disease are all present, and you mix all of this together, and it's not hard to understand, and our promotores see it every day, that folks are just exhausted from the amount of stress that they're facing. And when you come to them talking about, well, have you thought about a booster? Have you thought about maybe whatever the precaution is going to be for a particular aspect of COVID, that it's almost like they don't pay any attention. They can't pay any attention anymore. And so what I wanted to take this period of the training is to kind of go back and refresh how we build those relationships and the magical skills that community health workers have that will help us get past this this goal of high chronic stress? Okay, just a second, because I think Guadalupe is out there, and I'm going to get her for changing all the screens. This is something that you're familiar with. Some people use different aspects of it. We've sat in meetings with a lot of people, and they only talk about the social dimensions of housing and transportation. But there are lots of social dimensions. There's more than we could put here. And what these are, they are conditions of life that all of us have. And these conditions, these dimensions, these variables, all have an effect on our wellness. And they can have a very positive effect, and they can have a very negative effect. They can have the ability to change very rapidly from good to bad or from bad to good. And they also have the capability of offsetting another dimension by working overtime. And I'll give you some examples so we make sure that we understand that when we're working with our most vulnerable populations, that these stresses that affect their overall individual and family wellness were present before you showed up, and they're going to be present after you leave. And it's our job to sort of understand how those dimensions are affecting them, and what can we do to help relieve some of the high chronic stress from those dimensions that are having a negative effect on their wellness. Okay? Now, just let me give you an example of how things can get real good real fast and bad real fast, and how that affects everything. Occupational dimension. What I mean by this is we're talking about your job. And since I suspect most of you don't work for free, your job is attached to a salary. And the salary allows you to purchase and have resources. And if you have more resources, you have more options. You have more options where you live. You have more options of what you eat. You have more options on your transportation. Instead of riding the bus for 3 hours every day to get to a job, if you could have resources to purchase a car, you can cut that travel time in half, which leaves more time for you to do things that are maybe more beneficial to you than riding the bus. But so occupational income, those are often sort of in the forefront of people's thoughts when they get out of bed every morning. Am I going to have enough to provide for my family? When COVID hit, a lot of businesses closed. A lot of the frontline workers lost their positions. They had no idea when those positions might be open again, or if they were going to get full-time positions again. So that had a tremendous impact when we're going around with flyers saying, get your shots when the shots were available, and they're still worried about, am I even going to get a job, and how am I going to be able to support my family? So that's what I mean, is that you have to understand that, that there's a lot of dimensions beating on people. Your social, and what I'm talking about there is, and that's very good for us to understand, are the relationships that you have within your family and your community. And like all of us, we have relationships that are just perfect, and we have other relationships that are less than perfect, and we have some that are toxic, and we have some that, you just drive you nuts. And all of those relationship social pressures can have an effect on you and your ability to do things, all right? Our community health workers tell us very often that when families start cooking in a different way, relying less on packaged foods and relying more on fresh products and less fried food, that folks along the table will look at them and going, what's wrong? Why do we have to eat this? And there's this social pressure going, well, I don't understand, and it's a resistance. And you tell them it's good for you, and but that's not what they're used to. That's not what they like. And so that relationship complicates your ability to maybe look at your wellness and see what will happen. And those of you that have lost weight and gone on a diet, the first things your friend said to you is, what's wrong? Are you sick? All right, got to be something wrong with you. And so, that sea of relationships is always out there. And the other ones, again, is that what I want to express is that when one relationship is particularly stressful, let's say you just lost your job, and with that comes the loss of or uncertainty of income, and you come home to your spouse, and there's probably a lot of reactions. But let's say the spouse says, "Don't worry, you're a good person, you're smart, I know you'll land on your feet, you'll take care of the family." Okay? Or would you get the response, "My mother told me I shouldn't have married you, that you'd never be a success, and we're all going to go in the poorhouse." That's how relationships can either help overcome a difficult situation with a positive, or they can even make it worse by being a double negative. And so if you lose your job, but you have very strong relationships among your family members, your spouse, and everybody, supporting you, saying, "Don't worry, we can get through this," that's a lot different stress on you as an individual than if it's the opposite. And again, those things can change. And we just need to always be aware that those pressures, those influences are always present in our vulnerable communities. And they are often the ones that have the highest level of stress, are often the ones that people will not discuss until there is a genuine, mutually respectful relationship. They may talk to you, "Yes, I have food uncertainty issues," but they're not going to talk about the abusive family member. That comes later after the relationship is cemented. So those are always things that we have to be working on and be aware of, so that we try to uncover and work towards minimizing or alleviating some of those really high levels of stress coming within those social dimensions. Okay, so when we have high levels of stress and uncertainty, what do promotoras do to really have the most impact, positive impact, on vulnerable populations who have a disparate effect due to those stresses? Those stresses really affect their overall family and individual wellness. Okay? Well, first we have to recognize and identify which of those unserved populations are we reaching, and which underserved populations can we reach better, that we can actually improve our outreach. During the pandemic, we saw a lot of disparate outcomes as far as immunizations in the early stages of the pandemic in Bexar County, with the access of the COVID vaccinations on the south side of San Antonio. And so how were community health workers enlisted to identify those south side populations, particularly the more almost semi-rural populations of the south side of Bexar County, and how can we engage in understanding what they need and how to be able to provide the COVID vaccinations, and at the same time recognizing the other variables within the chronic social dimensions that are affecting them too. Health literacy. Public health has really become much more visible since the pandemic, all aspects of public health. And even though, we've been in sort of epidemic proportions of obesity and diabetes and hypertension and other chronic diseases, I think that the recent pandemic has really awakened more individuals as to the ways of prevention and healthy living, and what their real outcome could be as we move into an uncertain future. And so we have to take the language of the clinicians and the language of the public health officials and make sure that the populations that we serve, the community that we serve, understand what the message is and understand it in ways that they can relate to it, and where community health workers can really make a difference is by giving individuals examples. This is what is meant. This is what is meant. And then you get the better understanding. You know, it's not enough to hand out a pamphlet. It's not enough to tell a person you should go see your doctor to get your blood pressure checked. You have to go beyond that and say, how do we get to that behavior in order for this to occur? What do they have to understand about undiagnosed high blood pressure? What does that mean in my ability to continue to work and earn an income for my family? What if my diabetes is uncontrolled and I start losing vision, or my tingling in my hands because of the retinopathy, or not retinopathy, but neuropathy? Now I can't grip and do things like I used to as a roofer or laying floors. So there's that translation that has to occur. The underserved populations also are affected by the disparities in health. We saw, if you look at the mortality figures within Bexar County for Hispanic, white, and Black populations, you'll see a significant increase in mortality rates among the Black populations in Bexar County. And it's not because they're physiologically different or more vulnerable. It's because of their access and their availability and the reference to health literacy and the experience of Black populations is different, and it needed to be addressed in a different way. And people who have those relationships and work with the Black community realized that and needed to change tactics in order to help the population overcome those disparities. But I want you to make sure that you understand that while I believe in a lot of self-efficacy of doing the right thing the right way is an important individual characteristic, for a lot of our communities, there are built-in systematic disparities. They live in communities that were redlined 50, 60, 70 years ago, that development was overlooked in those communities. They suffered for years for lack of school funding. It wasn't only recently that school funding in Texas was shared, not due just to property taxes in a wealthy schools getting more money, and property taxes in poorer schools got less money. So students in those two school systems receive two different types of education. You know, those have nothing to do with individual self-direction and efficacy. Those are systematic policies that put people at higher risk, usually based upon their ethnicity and their skin color, and sometimes their religion. So it's important to us that we bridge not only language gaps, but cultural gaps. You know, in South Texas, we've seen an increase in recent immigrants coming into the Bexar County in South Texas, where Spanish is not the primary language and where Christianity is not the primary religion. And so our community health workers have had to broaden their outlook on what types of languages, how do I communicate, how do I understand the different cultures. And instead of trying to make the individuals fit into our predetermined sense of what is a good language, what is a way to communicate, and what a culture should do for individuals as far as their health concerns and other social dimensions, we have to grow and be open to that, because it is different. And not only is it different among populations, it's different among individuals. Each individual has a different cultural and language setting. The one that I put in blue there, achieve behavioral change. Those of you that have come through my training classes and Guadalupe's training classes, you know, I'll tell you flat out that as a community health worker, if you aren't influencing behavioral change, then you're not doing your job. And I don't care how many koozies you pass out and how many health fairs you have, you know, if an individual is not being guided towards behavioral change and making changes that have an impact on their overall wellness, then we haven't accomplished a lot. We can tick boxes, but I don't know that the overall wellness or the personal wellness of individuals is changing. We have to influence behavioral change. And one of the ways to really do that is to always model the behavior that you want other individuals to perform. Improve adherence to clinical advice, particularly to prevent chronic diseases. You know, that clinical advice can often be bewildering. And a lot of clinicians are on a appointment schedule that really doesn't allow them to discuss, inform, expand, answer questions. You know, you've got about somewhere between 8 minutes and 10 minutes, and that's it. The next patient has to roll through because the organization has to produce resources in order for them to perform their mission. And so, you know, there's different ways of doing that. The University Health System here in town, their family medicine folks downtown, they have the community health workers that work very closely with their most at-risk diabetes patients and other chronic diseases to make sure that the individuals understand what they are supposed to do in a language and in a culture and an approach that makes sense to them so that their behavior can change. And that's a lot of time and energy that's done there because you have to have that relationship before you can influence behavior. And again, community health workers can really provide that extra leg on a stool to provide the stability for reducing the risk of chronic disease that is more cost effective than other clinicians trying to do that. And they do a very good job of doing that because of what we call the ability to have superpowers. All right. The peer relationships that community health workers can form are just a tremendous advantage. And these relationships are the result of having similar life experiences, being able to converse in similar languages, and having experiences in similar social status. Now, that doesn't mean that a community health worker can't go into an environment in which everything is different for them. They don't have those peer relationships. They may not share that language experience. They may not have shared those social experiences. They can do and accomplish that, but it will take more time. If you have walked in those shoes as a community health worker and you understand the experiences, you understand the social status of being Hispanic or Black or Asian, whatever it is, and you can approach the individuals with that wealth of superpowers, then those relationships get stronger much quicker. If you're sort of outside of that, what folks in the community may think of as a tourist to the community, you can do it, but it's going to take you longer than someone who has similar experiences. And that is truly a superpower because once the relationships are formed, once people trust what you say, they look at what you do and they trust that, then you begin to have an influence in behavior. To give a highlight of the first case study that's coming up with Ludvina is looking at the stresses of type 2 diabetes in a world of COVID. And what do you do to address that stress in order to prepare a relationship to influence behavior as to how it affects a person's attitudes towards vaccinations or social distancing or whatever. And the diabetes garage is male-centered because men have a difficult time taking advice and instruction, particularly about health risks. So in a Zoom format, the incentives, toolkits, those types of things, glucometers, the whole process of managing your type 2 diabetes is sort of in an automotive language. Let's get this fixed. This is what you need to do to diagnose a problem. And that peer interaction really does strengthen the relationships among the group, and that leads to the change in behavior, which is what we're all looking for.